What does it take to go to chiropractic school? What is chiropractic school? If you've ever been curious about this process, this is the video for you. Good afternoon, heroes. Today we're going to be kicking off 2025 with a student series. So let's be honest, we've all seen chiropractors cracking backs, adjusting individuals, helping people get better, helping people maximize their health and their full potential. Thought about what is the process to becoming a chiropractor? Have you ever thought, what does it take to go to chiropractic school for you? What you learn within the program, how that process operates, and then afterwards, what can you do with it? Is a Doctor of Chiropractic program. Med school is like going to massage therapy. Where do we begin whenever we actually examine what is a Doctor of Chiropractic program? A Doctor of Chiropractic program, or DC, those two are interchangeable. So if you hear DC, be thinking, hey, this is what we're talking about. It's a professional doctoral program that trains students to become licensed chiropractors. Think of it like med school, but specifically focused on the nervous system, the musculoskeletal system, and specifically the spine as well. Just about adjusting people's backs. Chiropractors are trained to diagnose, treat, and manage musculoskeletal conditions as well as a variety of other conditions. Not every school offers a chiropractic program. There are specific universities that have programs accredited by what is called as the CCE, or the Council of Chiropractic Education. They're the ones that come in and tell the colleges like, hey, look, these are all the things that we consider to be high priority and what we think needs to be testable information for students to be able to get licensed as chiropractors. Because let's be honest, the chiropractic college is really about two big things. Making sure that you're understanding everything that you are required to have and your responsibility within your profession, and then which includes the safety of the patient. And then the other aspect of that is that you have to get through 4 parts of national boards: part 1, 2, 3, and 4. Okay, that's what they call them. And they cover different criteria throughout your entire experience within the chiropractic school. Your ability to get licensed. Like, those are the 2 main priorities for completing your chiropractic education. So most chiropractic programs usually take between 3.5 to 4 years to complete. So I attend Life University in Marietta, Georgia. And this institution is on a quarter system. So very much like the business world, you have first, second, third, fourth quarter. Well, within these quarters, there's 11 weeks. So it's 44 weeks of schooling. So you get the rest of that time off. So usually what happens is you have a winter break. So it's usually about 3 weeks. And then you do quarter 1 and 2, which is winter and spring quarter. And then you have a little bit of a break during the summertime, the summer quarter, and then into the fall quarter, before it repeats again, right? So you're going to complete 4 quarters in 1 year, and then you'll do 5 through 8, and then 9 through 12, and that'll all be done on campus. Now, within Life's program, we have something that is called a peak opportunity, which means that you go to a licensed chiropractor's office and you operate within their peak program, and you have the chance to operate underneath their license. So it is really a real-life clinical setting that you'll be in. We'll talk more in another video about the day in, day out of your 1, 2, and 3, because it really does progress. But what you're really going to start with in the beginning is having a real good understanding of your basic human anatomy, physiology, biochemistry, and then from that, diagnosing stage where you are looking at pathologies and how to diagnose those pathologies, and expanding on some of the treatment options. And then you really enter into your clinic phase, year 2.5, 3, and that is where you're focused on your inpatient and outpatient clinic, if the school offers an outpatient clinic. I also just want to point out that every chiropractic institution in the world, really, while they all have to meet certain criteria for testable information at the board level, what you're going to realize is that everyone has their own unique experience. So for instance, you and Marietta, like, we're a very large institution, the largest in the world, in fact. So there's a lot of students. So I've been in classes that have 100 to 200 people. I've been in classes that have as little as 16 people, or even 5. So it's just, there's a very broad spectrum in terms of how many people are going to be in classes, and that even, honestly, that is even going to impact some of the smaller institutions, which you might appreciate. You might like the idea of having only 5-10 people in your class, and those are the people that we have an opportunity to get closer to and build throughout the program. Moving into the next part of that, we are going to be talking about kind of the clinical setting here at Life University. And right now it's divided into, you go in, you have to hit a certain amount of requirements for the student adjustments, and then you have to hit a certain amount of requirement for an outpatient adjustment. So you're operating in both scenarios under a licensed chiropractor who is on faculty there. Their job is to be in the clinic to oversee us as we go through the whole process, working with either other students or patients that are coming out from the general populace to come and get adjusted. So you're going to be, especially year 1, you're going to be covering your anatomy, physiology, everything you need to know about the human body. We're going to be looking at neurology, biomechanics specific to the spine and the movement of the body. Radiology, we have like over 30 credit hours of radiology that we have to do, including the pathologies. And of course, adjusting techniques. And of course, that's where the magic happens. And then a little bit of business and practice management, and we'll talk about that a little bit later. So you're not just learning how to adjust, you're learning how to diagnose and manage patients. This actually goes into the next part, or the final piece of this, and that is going to be, well, where do you go from that? You get licensed, what's the game plan? What's the game plan? You need to know what you're doing with your life, right? So a lot of people coming in, like myself, who's, a little bit older in life, a little bit more experienced, has had some type of career in the past. Most people like that are probably going to be on the track of like, hey, I'm going to open up my own business. I want to run things myself, okay? Which is a wonderful option. Some people do not want that option. That is completely okay. And most of those people are going to fall more in the category of what we call an associateship within chiropractic. So what will happen is you'll get licensed. Instead of opening up your own spot, you'll say, hey doc, you're down the road, I'm gonna come work for you. You'll sign a contract with them. You'll work for them. You'll be an employee. You don't have to worry about the business aspect of it. You just get to walk in, help people get better, work on patient management and expectations of care. But there's other forms of that too. So one of the hot topics that I've talked to a lot of new chiropractors about is actually just contract work. We'll dive more into that. Another example too is like an international chiropractor. Maybe you just want to go overseas and go hang out and just be in some different countries. It could be you want to do missionary work as a chiropractor. It could be that you're operating under a foundation. Real quick, look forward to the video next week. We're going to be talking about the specifics, the ins and outs of your year 1, 2, and 3 within the chiropractic program, and then even talk a little bit about peak. So I look forward to seeing you again, heroes. Thanks for tuning in. If you have any questions, comments, you just want to drop a like in the box below, just let me know. I'd really appreciate it. So good to hear you. Once again, my name's Austin. I am here for your education, for your passion and drive to learn more about chiropractic as a profession, as well as a student. So please just reach out if you need anything, and we look forward to hearing from you.